All right, welcome everyone to our master class on patient scripting for the IRIS exam. My name is Lauren, this is Rebecca, and we are conducting this webinar as part of our ongoing support for our clients. As you've noticed, we've been sending out a newsletter and we're going to be conducting regular webinars in an effort to address some of the challenges and questions that you all have. So we're really excited to be here with you today.
Just a couple of notes. First, we are not going to address any billing questions today. So there are so many variables on your processes and your billing. So we can't simply address all of them in the time we have today. So if you have questions about billing or talk to your patients about billing, please contact your supervisor or someone in your billing department to ask those questions. We also have that Q&A box open at the bottom of your screen. So if you have any questions throughout the webinar, please feel free to submit them in that section and we will answer them at the end.
All right, so just want to give you all an overview of what we are going to be discussing today. So we want to cover explaining this exam to your patients, how you're going to present it, explain what's going to happen, and then conclude the exam and talk to the patient about the next steps and how they're going to receive results. So we'll cover all of those for you today. We'll also role play a patient exam so you can see us do that in real time. And we're going to address any frequently asked questions from your patients, and then of course answer your questions as Rebecca mentioned.
So before we get started, we just have a couple of questions for you. So I am going to go ahead and launch a poll, and we'd like you to take just a couple of minutes to answer these questions. Looks like about half of you have answers in. We'll give a few more seconds.
I'm going to go.
Okay, so let's go ahead and wrap those up, get those answers in. Okay, so I'm going to share the results with you guys. It looks like almost 50-50 split on that first question, who is offering the exam to your patients. And then it looks like most of you can do the exam at some point before the provider signs the order. And then about a third of you have to wait for that provider to sign the order before you can start the exam. So that's great for us to know. Thank you so much for sending those answers in.
All right. So that brings us to the first section, which is how do we present the exam? So for those of you who are presenting the exam to your patients, we just want to cover a few talking points. So one thing to keep in mind, this is for your diabetic patients who are not currently going to an eye specialist to receive the diabetic retinal exam. So as most of you probably already know, your diabetic patients are at risk for losing their vision or going blind as a result of their diabetes. So they should be every year going to an eye specialist to have the diabetic retinal exam. Nationally, less than 40% of the diabetic population is actually taking that referral. And so the reason that you all have the IRIS program is because we are trying to bring this exam to those diabetic patients who are not currently getting the exam. So that is who we are targeting for the IRIS exam.
We found it most effective for you all to present this exam similar to any other diabetic screening or testing that the patient would already have. So for example, an A1C. If your patient is due to have their A1C checked, you're not going to, ask them if they feel like doing it today. You're going to tell them that they're due and take the steps necessary to get that completed while they're in the office. So you can approach this exam in a very similar manner.
Absolutely. We also want to make sure that we emphasize the importance of the exam. So a lot of patients don't really understand that their diabetes can cause them to lose their vision. So we really want to highlight you are due for this exam, and it's very important that you receive it because diabetes can affect the health of your eyes to the point where you may lose your eyesight. It's a lot easier to treat diabetic retinopathy the sooner that we catch it. So we really want to make sure that we're conducting this screening every single year. So if we find something, we can address it quickly so that you don't lose your vision.
A lot of patients are concerned that it's going to take a lot of extra time to do the exam while they're in the office, and they may have things to do after their appointment. So reassure them that it will be a very short amount of time, somewhere between 5 and 10 minutes. So that can also help them feel more comfortable doing the exam while they're already in your office. The second step in speaking with your patient is explaining what's going to happen during the exam. So I usually like to say something like, we are going to take a few pictures of the back of your eyes today to see if diabetes has affected the health of your eyes in any way. If you notice, I said a few pictures of your eyes. You don't want to lock yourself into saying a picture or one picture of each eye. That way, if you end up needing to take multiple, the patient doesn't feel like something is wrong if you took more pictures. Another thing you want to mention is the flash. That flash can be very surprising if the patient doesn't know it's coming. So just make sure they know there is going to be a flash. It's similar to the flash of a regular camera so that they know what to expect. And then you want to tell the patient what they are responsible for during the exam. So things like where they should be looking. So if you have an internal fixation point or an external fixation point, where you want them to sit, how you want them to hold their head. So if you have a tabletop device and they need to put their head in the chin rest, if you have a handheld device and you want them to cover one eye, give them those types of instructions that are dependent on your camera type. And then you want to answer any questions they have before you get started.
Speaking of questions, we wanted to get an idea from you all about the most frequently asked question from your patients. So we put together some of the most frequent questions that we know about, and we're looking for you all to just choose the question that you receive most often from your patients. While Rebecca is launching that, I do just want to address one question we received. A copy of the recording will be made available. So if you're not able to stay for the entire presentation, you will be able to receive a copy of it at a later time. So great question.
Thanks, Lauren.
All right, and it looks like we've already got some of you answering this poll. Almost half of you have submitted your answers. All right.
Just a few more seconds here, and I will end that poll. We will share those results with you as well. All right. So it looks like we have a close tie. The very most popular is, does this replace my vision exam? Closely followed by, how long is it going to take?
Not surprising.
Not at all. Yes. Thank you all so much for your input. we get these questions quite frequently as well. So Lauren, does this exam replace my vision exam? I just got these glasses, a couple of weeks ago. Do I still need to do this?
That is a great question, Rebecca. So this does not take the place of your vision exam. This is actually a medical test to see if diabetes is affecting the health of your eyes. So we're not going to bill your vision insurance. This is a medical exam. We want to see if diabetes is affecting the health of your eyes. So it doesn't have anything to do with your glasses or your prescription or anything like that.
Do you think I already did this at the eye doctor when I got my glasses?
There's a chance that you did it, depending on whether you saw an eye specialist or an optometrist. Typically, if an optometrist conducts this exam, they do charge you extra. Do you remember if that was what happened?
I don't think so.
Okay, so it sounds like you probably did not have this exam.
Okay, great. Well, we can do it today.
Absolutely. So as you saw, some patients may think that they've already received this exam, and we want to make sure that we ask some clarifying questions. We want to ensure that we're closing that gap. So if your patient did receive this exam, we want to make sure that you get those records. So that would involve reaching out to their eye specialist, their optometrist or ophthalmologist, and ensuring that you get those records so you can close that gap. And then in the case of a patient returning in 3 to 6 months for a follow-up, you've reached out, you haven't received those records, they're still showing as due for the diabetic retinal exam. At that point, you can go ahead and conduct the exam because more than likely they did not receive it.
Great.
All right. So Rebecca, how long is this going to take?
It is not going to take much time at all, Lauren. So depending on the size of your pupils, it could take anywhere from 3 to about 10 minutes.
Oh, that's not too long.
No, not at all.
Awesome.
Lauren, if I do this today, do I have to take my contacts out?
So the good news is your patients will likely not have to remove their contacts. The answer to that question does depend on whether your organization uses dilation drops. So contacts do not interfere with the exam. If you were using natural dilation techniques, the patient does not have to remove their contact lenses. If your organization does use dilation drops, if the patient's eyes don't dilate very well naturally, that patient would need to remove their contact lenses when you administer the dilation drops. So another question we frequently get is, are you going to dilate my eyes? And so that kind of feeds into that same line of thinking where if your organization allows you to use dilation drops, the answer to that question might be maybe. So you would just let the patient know, we're going to try natural dilation techniques. We'll take the exam in the dark. And if we do need to administer dilation drops, it's a very mild solution. You will be able to drive and you can let your patient know what to expect with that. And also make sure that you're following any dilation protocols as stated by your organization if you do end up administering those drops. If your organization only uses natural dilation, then you would let the patient know you're going to just use natural dilation techniques. You're going to conduct the exam in the dark, and you're going to allow their eyes to dilate naturally so that you can capture the images.
Another question that we get very frequently is this going to hurt? Is it going to touch my eye? Or are you going to blow air in my eyes? So that's another thing that we hear a lot. Definitely you want to reassure your patients, no, we are not going to touch your eye with anything or blow air in your eyes. You may feel the eye cup on the skin around your eye if your organization is using a handheld device. Otherwise, the only thing they're going to experience is that flash of light. So reassure them it is not going to hurt. We want them to be as comfortable as possible.
Absolutely.
Okay, so the last step in talking with your patient is concluding the exam. So after you have taken the images, we want to let the patient know what's going to happen next. So when they will get the results, how they will get the results, who is going to give them the results, those kinds of things. It's great to just address those up front. So I like to tell the patient that we will upload these images to an eye specialist who will review them, and then the results will get sent back to the office, and then we will contact them at a later date. So that later date depends on your workflow. So Iris, we promise to get the results back to you within 2 business days. So you can add a time buffer onto that 2 days to give yourself a little bit of time to go through your internal process with those results. So when you tell the patient when they'll get the results, you'll also want to let them know how they will receive them. So if you will give them a call, if it's through a patient portal or any other means of communication.
We also have some best practice recommendations. So you may have encountered this with other tests with your clients or your patients. They are curious to know your thoughts. So you take these pictures and they say, did you see anything? So we want to let the patient know that we're not qualified to interpret the images. As Rebecca mentioned, they will be uploaded to an eye specialist. We typically recommend avoiding showing the images to the patient, as that can kind of prompt questions that we may not be prepared to answer. And so we just want to let them know that we're just taking the images. We need to show the anatomy to the eye specialist so that they can interpret the images and make a determination. Another thing we also like to recommend is at the end of the exam, open the door before turning on the lights. That way you and the patient, your eyes can get a little acclimated to the light. You've been in a dark room, so sometimes flipping on that light switch can be a little much for you. And then if your patient complains of seeing any spots from having the pictures, the flash from the camera, you can just have them, once you have turned on those lights, have them look up at the light, and that will wash out those spots that they may see from the flash from the camera.
Okay, so before we move on, I just wanted to remind everyone, if you do have questions, go ahead and submit those in the Q&A box. We already have a few rolling in, but Lauren and I are going to do a quick role play demonstration here of the whole process, and then we will start addressing some of your questions right after that.
All right. Hello, Rebecca. How are you today?
Hi, Lauren. I'm good. How are you?
Doing well. So I see that you are due for your diabetic retinal exam. Not sure if you're aware, but as part of your care for your diabetes, we want to make sure that diabetes is not affecting the health of your eyes.
Oh, okay.
Diabetes can actually make you go blind. I'm not sure if you're aware of that.
I had no idea.
Yeah, so you're due for your diabetic retinal exam, and I can take those pictures here today, and we can see if diabetes is already affecting the health of your eyes. So since you're due, I can do that in the office here today.
Well, I think I just went to the eye doctor and got some new glasses a couple of weeks ago. I probably already did it.
You probably did not, actually. So the optometrists frequently don't conduct this exam as part of a vision test.
Okay.
This is actually a medical exam to see if diabetes is affecting the health of your eyes. So it's not related to your prescription or your new glasses or anything like that.
Okay. How long does it take?
It should only take us between 3 and 10 minutes. So not long at all. I know you've got things to do, so I want to
Okay.
make sure I can send you on your way
Yeah.
very quickly.
Okay, sounds good.
Awesome. All right. So I'm going to bring you into the exam room. And Rebecca, I'm going to have you remove your glasses for me. And so as you can see, I've got a handheld camera here. This is what I'm going to use to take pictures of your eye. And I just want to let you know you're going to see a flash from my camera, just like from a regular camera. It's not going to hurt. There's no puff of air or anything like that. So you won't experience any discomfort.
Okay.
You will feel my hand. I'm just going to touch you in your forehead and temple area, and that's so I can balance the camera on my hand. So I'm going to get kind of close to you, a little bit in your bubble, to conduct this exam. And you're going to see a blinking light inside the camera. So I just want you to focus on that when you see it. And I'm just going to take a few pictures of each of your eyes. And as I mentioned, you'll just see a flash from the camera when I do that. Any questions for me?
I don't think so.
All right. So Rebecca, I'm going to have you cover your left eye for me. I'm going to approach you from the right side, and you'll feel me touch your temple as I come closer to you with the camera, and you just look for that blinking light inside the camera for me. All right. Okay. Now I'm going to move over to your left eye and we'll do the same thing. So just cover your right eye for me. Look for that blinking light inside the camera. I'm going to touch your forehead here. All right. So it looks like I've got everything I need. I'm going to upload these images to the eye specialist. They're going to review those to see if there's anything going on. And we should have those results to you in your patient portal within 5 to 7 business days.
Okay, thank you so much.
All right, thanks for your time. Have a great day. And it's as simple as that.
I know you probably have seen us do this if we've been at your clinic during training or even online on virtual training, but it's always good to have a refresher. So if you have any questions, go ahead and send those in and we will get started answering them. So Lauren, you want to take that first question about dilation?
Absolutely. So our first webinar actually does a deep dive into dilation. So that recording has already been made available. The question is, they should sit for at least 10 minutes to dilate. And so in our previous webinar, we talked about this. It's very common. A lot of our clients think that the patient has to sit for 10 minutes right off the bat. The good news is that some people, their eyes dilate very quickly. So our recommended workflow is to bring the patient into the room, turn off the lights, leave the door cracked. At that point, you can have the interaction that Rebecca and I had where I explained to her what's going to happen during the exam. I clean the eye cup. I let her know what she's responsible for. And at that point, I can go ahead and try to conduct the exam. A lot of people, their eyes will have already dilated enough for us to capture sufficient images. If at that point your patient's pupils are still too small, that's when you would want to evaluate either using natural dilation techniques, such as letting them sit in the dark room, or perhaps utilizing dilation drops if your organization allows that.
We have another question similar related to dilation. It is, how do I reorder the glasses if they use the dilation drops? So you will order those from the supplier you get all of your other medical supplies from. So get in touch with the person who does the ordering at your office for those.
Similarly, we've got a question regarding lens cases. Do you recommend we have lens cases, saline, et cetera, in the office? Are there any other supplies we should have on hand for any instances such as eye dilation? So if your organization does allow you to use dilation drops, we do recommend having saline and lens cases on hand for patients who have to remove contact lenses, as well as, of course, the tropicamide solution, and maybe a few dark glasses in case your patient requests them. Most people don't, but it's nice to have on hand. And as Rebecca mentioned, all of those supplies can be ordered from your medical supplier if you don't have any on hand currently.
And just a reminder, you only need the patient to remove their contact lenses if you're using those dilation drops. Any other time, if you're just using natural dilation, the patient can leave their contacts in.
Perfect.
So we have a couple of questions about using the camera and the chin rest. We can answer those offline. If you have a contact for your client success representative from Iris, they would be a good person to get in touch with about that. And I will make sure we send a follow-up email to you guys as well.
All right, so we've got a question. Is there any special way to keep light from coming through while you're capturing the picture? So light can be the result of a few different things. Sometimes it's eyelid interference, sometimes it's camera positioning. So depending on the reasoning for the light, that would dictate the different techniques that you might use to prevent that from happening. You do want to make sure that you are taking these images in a dark room. The darker the room, the better. So hopefully that will help with keeping any light from interfering with the exam.
Okay, so the next question is about patients who have trouble fixating on the internal or external fixation point. So their eye doesn't stay focused. So that is a difficult situation. Sometimes it helps to have the patient cover the opposite eye. Sometimes it does not. So that can definitely be a challenge. Sometimes if you can coach the patient to look at something else, if they're having trouble fixating on that light. So coaching them to look straight ahead or look where they think your nose is or something like that. That is the best advice that I can give in that situation.
Absolutely. Another question, did I understand correctly? It is okay for the patient to have contacts on during the exam. Yes, that is correct. Contact lenses do not interfere with the exam. So the only reason a patient would ever need to remove their contact lenses is if your organization allows you to use dilation drops and you are administering those drops to your patient. Otherwise, their contact lenses can stay in. That is no problem at all.
So a couple of questions about training and about new cameras. We will get in touch with you all offline for those. So I'm taking notes on those.
Awesome. All right. So speaking of resources that you may need after the webinar, our help desk is a great resource for you all to use. You can submit tickets through the IRIS portal. You can give them a call and you can send them an email. So if you have any questions after the webinar and we are not reaching out to you directly, please feel free to reach out to us at any time. Help desk is very responsive and we love to answer any questions you have.
All right, so we have another question. This person missed the beginning, but is asking if we discussed billing. So just a reminder, there are so many variations at all of your organizations about billing. So we cannot address all of those today. Please speak with your supervisor or someone in your billing department. If they don't have the answers, contact your client success representative with IRIS.
All right. So another question regarding the darkness of the room. So our recommendation is a completely dark room. The darker the room, the better. Some of our clients do employ a red light. As long as that red light is not in direct view of the patient's eyes, it will not likely significantly affect their dilation. So if you'd like to have some ambient light in the room, a red light, night light might be beneficial to have. But truly, the darker the room, the better. A lot of our clients conduct the exam in a completely dark room. You want to make sure, if possible, there are no windows. And if you do have windows, consider putting blackout curtains or something else in the room because that really does help with the patient's dilation, which makes it a lot easier for you to capture quality images.
More questions about training and training materials. We will definitely follow up with all of you that have requested materials or additional training. We'll follow up after the webinar. All right, any other questions? Get those in. We'll just wait another minute or so before we wrap it up. Okay, so we got a question in. This is similar to how dark the room needs to be, but if the member is not comfortable or the patient is not comfortable sitting in a dark room, are there any other solutions? So the best solution is to stay in the room with them, or if they have a caregiver who came to the appointment with them to sit in the room with them is another option. You can, like Lauren said, use the red night light if that would make them more comfortable. That red light does not affect their pupil size as much as other light sources will. So that is an option as well.
All right, another question. This is regarding the Iris University. Can I get back into those videos? You can at any time. If you log on to the portal at our website, retinalscreenings.com, one of the options is to access Iris University. And if you run into any difficulties with that, please reach out to our help desk. They are happy to help.
Okay, so one of the questions we have is, where do we get the recording of the webinar from today? So look out for that recording in next month's newsletter. So that will be out at the beginning of May, and you will see the recording in that newsletter.
All right. Another question, how can you tell if you have a good picture? So we likely will be conducting a webinar in the future regarding image quality. You should have received some image quality cards as part of the kit that you received when you began the program. Those cards go into a lot of detail regarding what an ideal image looks like, the parts of anatomy that the grading physician needs to see. If you can't find those cards or don't have access to them, again, please reach out to the help desk. We're happy to provide those resources to you digitally so that you can have a refresher on the anatomy and the types of images that need to be captured.
You can always go back to those Iris University videos as well to get a good refresher on image quality. So the next question is about patients with different pathologies and if you can dilate them or not. And the best answer is you need to follow your organization's protocol when it comes to dilation drops. So I would say the majority of you will need a provider's signature on the medication for the dilation drops. So that provider will be able to tell you if you should or should not dilate that patient based on their history. Okay, so we got a few more questions rolling in on training materials. Again, we will follow up with you on training materials after the webinar.
All right. So feel free to submit any other questions. We'll give it a few more moments. I want to make sure that we answer any of the questions we can while we're here. And in the meantime, we just want to take a moment to thank all of you for joining us. We know that you're very busy, and so we really appreciate you taking time out of your day to come learn a little bit with us and hopefully have some fun.
Okay, it doesn't look like we have any other questions. So thank you for your time. Look out for next month's webinar in the newsletter in May and for the recording of this one as well.
All right.
Thank you all.
Thanks, everyone. Have a wonderful day.
Bye-bye.